Things to know about bottom surgery recovery, part 1 and 2. Well, specifically number 1 and 2. They want to get your digestive system back up and running because the anesthesia kind of shuts it down. In my case, I'm on Wegovy, the weight loss medication, so that already slows things down. So there is Miralax and Colace and tons of water, and the catheter keeps your kidneys going. But as for making stool, they give you the stool softeners, they give you the regulators, they want you to be able to pass stool. They also want you to be able to pass gas. You're going to have a whole lot of gas, especially if you have an abdominal procedure where they do some laparoscopic work and do work from the inside out. They'll inflate your abdomen, so even more gas. But in my case, without that, there was still a lot of gas. And that's a precursor. I had a couple false alarms where I thought the gas was going to be stool, and it was not. It can be a little frustrating, but once it finally goes, they give you some different cleaners so you can clean off, because you definitely don't want anything transferring to surgical sites and getting infected, etc. But it's a process. It takes patience. You might have some gastric discomfort, some bloating from all the gas, and you have to relax to let it go. You can't force it because you don't want to strain a surgical site, and that whole area where you might force things normally is the surgical site. So that's why the pelvic floor physical therapy that I did in advance is so important. They teach you how to relax, how to release. It is important. Do not skimp on your physical therapy. It helped me a lot.